Hello, everyone. Welcome to the Growing Your Dental Business podcast. This podcast is where we explore innovative strategies for building a thriving dental practice. I am your host, Jacqueline Hurley. I'm the director of Dental Zing, the online educational platform, as well as the director of the consulting network at eAssist Dental Solutions. This podcast is all about talking to consultants and exploring ways to help the dental community. Today, we're going to talk about the Dentistry Advantage, and that advantage is you and your dental team. Today, my guest is Kelly Duggan, the founder of Kelly Duggan Image Consulting. She is a certified image coach, speaker, and consultant with a dental hygiene background, and that career has spanned her into general dentistry, pedodontics, and periodontics. Kelly helps her clients realize the power they have within themselves to develop their inner poise and confidence and position themselves strategically for a greater professional and personal success. Kelly helps clients authentically and strategically think, feel, and present their very best. Welcome, Kelly.
Thank you so much, Jacqueline. I was super excited to be here with you today and just this wonderful opportunity. So thank you.
Oh, you're welcome. I'm excited to chat with you too. I love everything that you represent when it comes to your image consulting. I feel like there's a lot of dentists out there who they're just trying to survive, and sometimes they don't think about the image side of things. So I'm really excited to dig in a little deeper into what you have to offer the dental community. So, why do you think it's important for a dental team to think, feel, and present their best?
One, because I'm a firm believer that people are their greatest asset. When we think about, all the work that gets done, whether it's a product or a service that we are dealing with, it backs to a person or people. And, we've all had that experience where, you had the opportunity for a service to go to a couple different places. And it was probably the individual or the people there that made your decision of where you went. So when we think about that in my sense of my work too, and we're going to be talking about this today, is that you really want to craft a total presence that's strategic to where it is you're going, the goals that you have, and that experience in this sense for your patients that you want to create.
That's great. I feel like that you have to start somewhere. And they always say you never get a second chance to make a first impression. So I guess that is where all of this comes from, right?
Precisely. Yes, exactly.
That's what I
Exactly.
was thinking as well. So, do you have anything specific you would like to share as far as when it comes to creating that ultimate patient care experience?
Definitely. So I mentioned that total care presence thought of creating, and it really backs into a combination of things. When we think about what presence or image, there's lots of buzz terms out there, those as well as personal brand, a variety of terms out there. But the umbrella of it is what we're talking about is strategic image management. So you want to craft that total presence or total image. And my beliefs in that is that you have the inner, the core, with the thought of that's where in dentistry, that's where your skill set, your knowledge, all the training that you have lies, which is wonderful and great, and your patients do want that, but they also want a great experience to come with it too, to support and feel cared for and trusted and so forth. So then tightly aligned around that thought of that center of that inner, or it could be called your hidden image too, because it actually contains a whole lot more than just your knowledge and skill sets. But also with that is that thought of, and it should be tightly aligned to that inner image, but it's how you think, look, act, speak, dress, and how you convey, again, back to that thought of your visual and experienced image to those that you're with. So crafting that carefully, and I will tell you this, I was studying this world of strategic image management while I was working in the periodontal field. At the same time, I was working part-time and had started my image business. And it was becoming a real business and continued to grow. But I had my favorite boss ever. Dr. Coverly, and he was a periodontist that I worked for about 10 years, and he had wonderful built-in people skills. It was just who he was, and not all of us have that, but again, it aligned with what I was learning in this thought of total presence and using yourself. But I say you're a tool. You can use yourself to get done what you want to get done. So with that thought, we know we shouldn't judge a book by its cover, right? But unfortunately we do, as even as much as we wouldn't want to. But what I say is, when we think, we'll use appearance as a thought, or even just the sound of your voice, because those are really the first things that are noticed before they ever know your knowledge or skill level, or the rest of who or what you are about. But it's your appearance and your sound of your voice. But again, we'll use visual for an example. So we've all met somebody who looked poised and polished and looked fantastic in their appearance. And then you got to spend a little time with them, and some nervous tick or some negative quality about their character or so forth came through. And then that ended the relationship, or vice versa. Somebody who was visually, in a sense, a hot mess, sloppy, unkept, whatever it might be. Um, Hopefully you had a possible time to be able to be with them multiples of times. But in our fast-paced world, in dentistry too, how often does that happen, where you have the ability to be with somebody multiples of time? Not often for them to experience you, but you don't have necessarily time to have them see again all those talents and gifts, and maybe they checked you off as a negative because of visually of how you were presenting. um, so what I say is, visual impact actually occurs in 3 to 4 seconds. So when we started this program today, you decided already if I had anything to offer before I ever opened my mouth. Now, the wonderful introduction that Jacqueline did helped support you, but actually subconsciously, unconsciously, you'd really already decided if I had anything to offer or not. So our goal again is that we want to strive to, create greatness and a cohesive thought. When we come back to that thought of a total presence, that it's not just how we look, it's not just what our skill level is, it's not just the sound of our voice, it's not how we communicate only in our, say, our nonverbal support. It's all of it working collectively together to be really strategic in how we present to our coworkers, to the people that come through our door, through vendors, to patients. So
That's
develop a total
awesome. I was
presence.
thinking about the doctor that you worked for initially when you
Mhm.
were starting your image business, and how he was such a natural people person. Is that something that you can learn to become a people person, or is it just
Mhm.
something with who you are within, embedded within you?
Right.
How does that
Yeah.
work?
How's that work? Yes, anybody can do it. We can all develop. We just need to, backing into it's our inner, our hidden image. We've just got to decide for ourselves that yes, we can do that, and that's an important thing. That it isn't just about our skill level and you wanting to behave exactly, on our own how we want to behave, but to be strategic about it.
Yeah, that's good. I noticed there was a piece on your website that said you focus a lot on soft skills. So would you consider that
Mhm.
being those soft skills versus hard skills?
Yeah, soft skills would be the word. And, for some reason, soft skills have caught a bad rap, or whatever you want to call it. I've heard
Yeah.
recently, I was on a call with a communications specialist, and her approach all is like striving to help people understand how important soft skills are. And she was terming them actually vital skills.
Oh,
um,
yeah.
that they're super important. They're what's going to help you have your message heard. It's going to open doors versus close doors for you. It's going to
Yeah.
create happy patients, happy team members. If you can craft and learn again to use your presence, and it's simple things. That employer that I had, I worked part-time for him. I worked on Wednesdays. Every Wednesday I walked in the door. He was in his office back by the back door. He says, I am so glad it's Wednesday. I am so glad you're here. That's how I was greeted every Wednesday I walked
Oh,
into the
how
practice.
sweet is that? That's kind.
Yes.
You can tell he was a kind
Mm-hmm.
man. So that's awesome. So
Mm-hmm.
as a practice owner, how can a team support that consistent brand and and in turn, we want our goal is to build our business, right? To build the
Mhm.
business as a practice. So how can they work together to support a consistent brand of exactly what you're saying, including those soft skills? Obviously, they already have the hard skills. They've already gone through all the
Mhm.
training.
Mhm.
Those vital skills, I guess, is what you said called them. How can they support that consistent brand of vital skills?
What I say, it's in the little things, it's in the details, it's in the things that happen that we may not even realize that we're doing and or not doing, but we can all learn to do that. It's even if as we're speaking here, I still try not to say in between words,
Yeah,
the
I
filler
know.
word
It's
things.
hard.
It's becoming aware. What I'd say, my work is a lot about strengthening your awareness muscle for yourself of what you do, how you do it, and again, being more strategic in the thought of creating a great experience for those that are around you and elevating the impression that you make on people so that it can help you open the doors that you want opened or have help create a more compliant patient or a referring patient, all those things, or a team member that will go the extra mile. When I was greeted every Wednesday like I was, and the whole bunch of other variety of ways that he used his verbal and nonverbal communications and so on and so forth, you would go the extra mile. I would stay late to help assist if an emergency patient came in, even though I was a hygienist. I would, when they needed somebody on a day off that I had off, that they needed somebody at the front desk extra, I subbed at the front desk a few times because of that. And I would do it willingly because of, again, the great experience that he created, not only for the team, but also for the patient as well.
That's
Um,
amazing. I think that is a big piece of being a good leader in a practice is being able to, it's funny because I was thinking about that. My daughter actually she's been an office manager for a pediatric dentist, and she's hired, girls have come and gone as team members for her, but I
mhm,
remember there was this one week they did not have someone to fill in on this particular day. And so she had called a team member that had been there months earlier just to see if she would come back in. And she said yes. And,
mhm,
to me, that just says a lot for the team. That says a lot for the dentist who treated her important. Like she obviously didn't want to disappointing when she was in his employment, under his employment, but then she didn't want to disappoint him when she had left the practice too. So I think that's a big part of, just exactly what you said, how he must have made them feel just like your dentist made you feel special every time you came in. And it seems like the goal with your brand and the things that you're doing is you need to figure out what it is that is unique about your practice and each individual person. I think of my
mhm,
hygienist when I go in. I've gone to a new dentist the last couple of years and I only see her. I met her. Then obviously I only see her, every 6 months, but she remembers our conversation. She remembers things about me. She remembers things that I've told her about my grandkids or whatever. And all of that
mhm,
is part of those vital skills I feel like that you were talking about.
mhm. Yes, yes, you're correct. You are correct.
That's so great. So we talked a little bit about having that leadership presence in the practice. What does
Mhm.
that mean to you when you're teaching these dental teams all about, leadership and what it means to have that leadership presence in the practice?
So what I say first is, defining really what leadership presence is. And when I first
Okay.
started studying that from the sense, like when I think of presence, it's what I, share, it's your total image and so forth. But what is leadership presence? So it's really made up of several factors where you have that, the someone carrying leadership presence, can enter a room confidently. We all have experience where we see somebody come in and they just are confident in what they do and so forth, or they command a room when they step up. Maybe they're speaking to a group, which I know some doctors and hygienists are out speaking as well. I may be we may have listeners here today that aren't just in a clinical setting; they could be in other settings as well. It's also assuming leadership at for varying audiences, being able to, what I say is kind of be a chameleon. Yeah, some people get stuck in, well, I'm going to be me, this is how I am, and so forth. But somebody with true leadership presence can weave their way through and be with varieties of people and still be genuine and true to them, because that's what real authentic presence is about, and that's what total presence is about, that you're authentic and true to you, and in the practice setting to true to the brand of the practice and so forth too. um, Also, somebody with great leadership presence can comfortably, confidently share their thinking and opinion in a manner that all can and desire to hear.
Yeah.
Um, and I say too that, somebody with great leadership and knowledge, some people get where they just talk and talk and talk, where they don't listen. And great leadership presence has the ability to talk and listen and have a communication style that supports them and their listener, so that their communication is not only persuasive if it needs to be, but also impactful as well.
Sure. No, I think that's really great advice for having a leadership presence in the practice. And, sometimes when you're clinical, you don't really have all of those vital skills. But at the same time, I think you can learn them. You can learn to just think of the person you're talking to and authentically talk to them, right? And just be
Mhm,
yourself.
mhm,
But at the same time, you want to get to know them and who they are. And, I think that's the best way really is just to get to know your patients and just support them. But at the same time, you want to educate them what is best for
mhm,
their oral
mhm,
health, right? So
mhm,
there's kind of that twofold of just being who you are, that personality comes into play, but also you want to let them know that you're educated and that you really want to help them with their oral health
mhm.
organically.
Yes, yeah, definitely. Um, and I would say too, in leadership presence, with that model that I was talking about earlier, total presence, that you have that internal, which is that hidden or inner you,
Mhm.
that no one else really sees unless you share it and express it.
Yeah.
It also has your values, your motivations, your beliefs, your character traits, your ethics, your self-esteem. And again, like we talked earlier, it's your abilities, your skill set and knowledge and all of that too. But then it's understanding then how to express all that on the outside. And that's where, those details of using your outer image, the experience and the visual image, in a strategic manner will then allow you to, um, again, be seen, be that person who can confidently and comfortably walk into a room, be heard, not only so your words are heard, but that the sound of what you say really expresses what you wanted it to mean and say. We've all heard voices of people speak, and like, I ask you to do that versus I ask you to do that.
Right,
There's a
right,
difference.
yeah,
Yeah. So,
yeah,
uh,
there is a
yeah.
difference.
Mhm.
Absolutely.
Yeah. Yeah, and I would say with that, the thought of doing this, it aligns the behaviors and so forth to help people, where for yourself too, that you're going to think and express yourself in a leadership role, and that's going to allow you to be able to connect authentically. It's going to allow you to build rapport and confidence. It's gonna allow you to be able to, if you're leading people around you, or it's guiding a patient to what you want them to do, and encourage their oral health and so forth. So again, it's back to that thought of encouraging and guiding. It's gonna help you put people into action, um, that is needed for whatever reason, or if it's just for a personal motive that you need them to do it. What I say too is you can use all these strategies at home. If you need your significant other to pick their socks up off the floor, you can use strategic image management to get that job done. So, these tools that you can put in your tool belt for yourself can help you at a professional level, but as well as personally.
Oh, that makes total sense. So do you have any I didn't ask you this before, but I was curious if you have any examples of practices that you've came in and really helped make a difference in their practice when it comes to leadership or, just being authentic with who they are, with helping
Mhm.
them with the relationship management with their patients. Do you have any examples of a team that you've helped?
Yes. So I've worked in, varying businesses actually. I left dentistry for a while, so I've worked in a lot of other, but specific to dental and healthcare. I worked in dental and optical, specifically, where we help the team collectively and cohesively present so that there was just a common vernacular, there was a common culture supported experience on how they use their total presence. Um, I think it helped them to understand the importance of what these things that, again, these soft skills are vital skills that really are kind of poo-pooed or pushed to the side, but yet are vital. They're so
Yeah.
important,
Yeah.
for what we do. Um, so, what I've heard from clients that I've worked with is that it gave them, again, that common vernacular so that they could work and cohesively be as a team and support the culture that they are. So I've done work where we just kinda, um, help them realize, kinda like ring their bell of realizing how important these things are,
Yeah.
that, some, different exercises that I do, um, teaching like that visual impact piece, uh it's a very short window of time that visual impact occurs. And
Right.
then I would say in the dental practice, for years, you've probably heard this, and I know others who've worked in dentistry, you got the front office and the back office and some of the divisions that can occur. And total presence will help that, understanding the roles, but how they need to actually cohesively work together to
Yeah.
support what needs to be done for the patient and the care of the patient.
I love that. I love that kind of brings me back to when you said, when you were in the practice, if you needed to answer the phone, you would answer the phone. If you needed to do, that's where that front team, back team kind of supports each other. And you have
Mhm.
to have a great relationship with each team so that you feel like you can be that support system for each other.
Mhm.
And I think that's great.
Yeah,
So
yeah.
let's move on to so what motivates you, Kelly, to keep
Mhm.
helping dentists and teams?
People have asked me, like, "How did you go from dental hygiene to an image consultant?"
Yeah,
And
that's a good question.
what I say is I fell into the image industry through the girly fun makeover land stuff, the fashion and style side and dress. I
Yeah.
started sewing when I was a little girl and so forth, and always like fashion and style. So that's where I started in color analysis back in the 90s. I'll date myself here. And but colors making a new turn. I have interns from fashion and merchandising school, university here near me in Michigan, and um color analysis is coming back. It's always been a core leg to style development, anything with
Huh.
design.
Right.
Color is a part of it, color and line and style. So that's where I started. And then I started having neck and back problems and I was having fun. So I kind of started this side hobby business. And then I was introduced to not only just the fashion side, but the image industry. And I joined an international organization, the Association of Image Consultants International. Have been a member for 20 years or so. I've served in several capacities. I'm currently serving on the International Global Board for AIC. I'm on the executive committee and VP treasurer.
Wow.
So it's an exciting thing. But back to your question though, specifically, like how did I, go from one to the other? It's the journey. And it's why the journey with my client or my patient. That's why I liked
Yeah.
periodontal work. Probably the best one. I loved the gory part of dental of periodontal work. But truthfully, I loved helping my patient get through for scaling and root planes, surgical care, post-op, suture removals, all those different things. I loved going on the journey with them. So similarly to my work today in professional presence, total image, executive presence, I'm certified in a personal brand assessment tool and, all my work, I would much rather do coaching or training work that's a series of multiples because I love to help that individual or that
Yeah.
group of individuals
Yeah.
successfully get from point A to point B, C, D, wherever success is, um, confidently, successfully growing, great success for them as they move forward in whatever it might be.
That's great. You know, I when I think of a dental team, I don't really think of fashion. I don't really think of image as much as I think of people, but I
Mhm,
just looking back at the different dental teams I've seen,
mhm,
when they all present themselves, they're all dressed accordingly to just what the image they're trying to portray versus everyone's just wearing whatever scrub they put on for the day. You know, I know
mhm,
my daughter's team, they have set colors that they'll wear certain,
mhm.
certain days of the week. And so they all
Right.
kind of look like we're a team here and we're here to take care of you. And
Yes.
I can see
Yeah.
where that image makes such a
Mhm.
huge difference.
Actually, yeah, it's actually very important when you think about, like, the little things, the details.
Yeah,
Most people don't understand or realize how color communication works. So, choosing and selecting your scrub colors or what style of scrubs, or do you have your front desk in scrubs or street clothes or some type of,
like a
uniform in a
professional
sense?
attire or something. Yeah, different. Yeah,
Yeah. Yeah, so some of the statistics on, color statistics alone, you're not even thinking about the style of things, but colors alone can influence up to 90% of an initial impression.
wow.
Hospitals went from code red to code blue for a reason, because red stimulates and blue soothes and
Yeah,
relaxes.
yeah,
Um, Color increases brand awareness by 80%. So
wow.
when we think about what I say, one of my what I say is a mistake, not only in dental land, but in any professional setting, I would say, is that you do not want somebody who's fashion focused choosing colors and styles because they're going to choose it on fashion. And there's a difference between fashion and image management.
Yeah,
Where you get into image management, it's strategic. It's taking into consideration, again, that color influences 90% of an impression. It knows and understands all of how color communicates and the physiological and psychological effects of color. Also, when you get into the design and line of garments in business, we want the attention to come to the face and the eyes. So there's different sets of design lines in garments, and that's why layered pieces or jackets or a v-neck or a row of buttons up to a collar on a men's button-up shirt, what it does visually is it leads the eye in and up
nice,
to the face.
nice.
And this area where you want the attention to come is what we call the magic Y. So if you think of that, if you think of a men's dress shirt again, the row of
Sure.
buttons, and if they leave the collar open or if they have a tie with the knot, it creates a little V shape, and
Yeah,
it does, it visually leads the eye up to the face. So in business, no matter what you're doing, even if you're in a mask and loops and everything else, you still want, when you're communicating, the attention come up to the face and eyes and then out to the business at hand. So color and line and being strategic in your dress, and somebody who's fashion focused and choosing colors and styles and stuff doesn't isn't going to be aware of that necessarily,
yeah. That
unless they just listen to this.
unless they listen to this and they're like, "Oh, yeah, we need to think about that more." Yeah, that makes total sense.
Uh-huh.
Well, thank you, Kelly. I feel like I've learned a lot from you today. I'm sure our
Thank
listeners have
you.
learned a lot from you today. Do you have how's the best way to get a hold of you? If a dentist is listening and he's thinking, maybe we could use some help with our image and just use some strategic planning with our team as far as helping us be, more image focused, more brand focused. How's the best way to get a hold of you?
The best way to reach me is via my website. I have a contact page where they can fill out a form, and I know specifically what they want to get in touch about.
Nice.
I'm also happy to have you just contact me direct. And my website has that information too by my phone or email, which that's all
Nice.
listed on my website as well. But I would say head to the website and you have my contact information direct to give me a call or an email, or fill out that contact form. And I check that pretty much daily. So we'll
That's
reach out
wonderful.
and have a conversation. Yeah, because I can help in a variety of ways, I will say. Even, when we think about the chair side communication, or I help to practice too. They wanted to implement an assisted hygiene format program, and we put a whole specific program together for them on how to do that and how to have a better conversation with their patients.
That's wonderful. That's fun. And it all kind of fits together when it comes to the
Hmm.
image of a practice. So that's
Hmm.
great. So
Hmm.
Kelly's website is Kelly. kellyduggan.com. That's with two G's, Kelly, KELLYDUGGAN.com. She'd love for you to reach out to her if you have some questions for her, or would like to just discuss anything. She does offer a complimentary strategy call. So give her
Mhm.
a call and check her out on your website. And we appreciate everyone for being here today. I'm excited to have you here, Kelly. Thank you again for taking the time to be here today. And that's
Thank you.
pretty much what we have for today's episode of Growing Your Dental Business. Keep smiling. Thank you for tuning in, and we'll see you next time.
Thank you.